You are watching CVR English. Welcome to another episode of Epione. In our studio, we are having Dr. Minal Chandra. We have discussed a lot about her treatment in the last episode, and we are yet with another episode. Welcome, Dr. Minal Chandra. Namaste. Ma'am, for the fresh viewers or the new viewers, can you brief up about your treatment? What exactly is this neuro orthopedics?
See, my thing is Epione Pain Management Center, where we treat all types of chronic pain with regenerative therapy. So, my clinic specialty is regenerative therapy. Now, what is regenerative therapy? It is using the natural healing potential of your own cells. So, every body will have their own cells, which we extract according to the need and according to the cell type that we want to regenerate, and then we will inject it exactly to the area where there is damage. So here in our treatment, we are not cutting anything, we are not injecting anything from outside. It is patient's own body cells, own cells which will regrow, which will multiply and produce a lot of other cells. Okay, so this is regenerative therapy, and this treatment was started in Epione, and we have treated more than 50,000 patients of only knee joint. Now in knee joint, we know that it's when it progresses, when the arthritis progresses from stage 1, 2, 3, 4 like that, they need to go for surgery. But what we are doing is without surgery, using regenerative therapy, PRP treatment, plasma treatment, growth factors, we are regenerating the cartilage so that anyone doesn't need to go for any kind of surgery. So this treatment will work for knee conditions. This treatment will work for any kind of joints: shoulder joint, ankle joint, hip joint, frozen shoulders, back pain, spines, and sports injuries. So it is going to work for all kinds of injuries, all kind of damage to the tissue, and all kinds of degenerative condition.
But without cutting anything or without injecting anything, how does the stem cell treatment would be working?
Yeah, see, first thing is, first we need to identify where is the damage. Okay, and how much is the damage. So how we do that? We talk to the patient, we take history, then we do certain test examination, then we have ultrasound scans. These are high resolution ultrasound dynamic scans, which will exactly identify the area of damage and how much is the damage, what is the extent of the damage. So once we have identified it, once we have mapped, we do a complete mapping. Once we have done that, then what we do, with the help of a small needle injection, that's a small needle, we will put it exactly where there is damage, and then we will inject the platelet cells, plasma cells. Okay. So we are not cutting anything, just we are putting a needle, just like a vaccine needle, like you would have taken some kind of vaccine. Same needle, we put it, and then we inject the plasma cells.
Okay. Is it anywhere related to the acupuncture traditional?
No, acupuncture and all does not belong to allopathic science, right? Whatever we are doing is an allopathic practice that is according to the research and medical protocols, and a lot of research that happens in medical literature according to that we are doing. So acupuncture is an alternative medical medicine therapy, right? So it's not related to, it's nowhere similar to acupunctures and all those things.
Okay. Ma'am, I remember one case which happened in my close family circle, that the patella bone, which is called as the kneecap of the human body, that was disfigured. And she went to a famous doctor who is considered to be one of the prime surgeons in India. They said that he prescribed surgery. But to take the second opinion, they went to another orthopedician who is also happens to be the similar notes. But he did the treatment without anything through sending the electronic waves. Okay. And the physiotherapist has done all this particular thing. So can you define the similarities and the differences between your treatment and that treatment?
See, what condition you're talking about, we need to understand. There is few conditions, like if it was a fracture or if it was a displacement, then definitely surgery would have been required. But if it is something like a condition called as chondromalacia patella, where the cartilage loss behind the patella is lost, in that case surgery is not required. So, like with whatever you are saying, it is very difficult to identify what was the condition actually. But chondromalacia patella can definitely be treated without surgery, without any kind of cutting. We just need to identify how much is the loss, and using patient's own blood, we can start treating it. Now, this condition is very common in young patients. Like you must have heard that knee pain will usually start in old age, right?
Yes.
But chondromalacia patella is knee pain in young patients. Okay, so I'm happy that you are asking this question about chondromalacia patella, because whenever young patients of knee pain will come, then it is, the patients are very anxious that I'm very young and why I'm having knee pain. And when we tell that you have cartilage loss, they are just disheartened and they don't want to accept it. But there is this condition where patient will have early knee pain. That is also because of cartilage loss only. But here the cartilage loss is happening just behind the patella bone. Okay, so this can also be treated with regenerative therapy.
Yeah, as you mentioned, actually, the family was very much nervous. They were unclear whether it will be cured or after surgery, whether she will be able to walk properly and all that. In this particular cases, as you mentioned about the young patients, how much you counsel and what is the trust levels you generate in them?
Yeah. See, the first very important thing is what we believe is talking to the patient. Why? Because what I know about the patient, what I know about the condition of the patient should be aware. Okay, it is not that patient is not a doctor, so he should not know his medical condition or only the name of the condition. No, it's not like that. So in our clinic, what we have understood is to understand the proper condition, we need to listen to the patient. So most of the time you see when you go to doctor, they say you have sir, I have knee pain. They will see the x-ray. Oh, it is grade 3, grade 4, go for surgery. That is all the conversation that will happen between a doctor and a surgeon, between a patient and a surgeon. But you see, when they come to our clinic, the most important first thing is that we have our junior doctors. They will take the history, so they are ready with the history. Now when the patient comes to us, we talk to the patient what they want, what are the symptoms. They will never complain. Most of the time, females, they will never complain that I have pain in knee joint. What they will have different type of symptoms. They will say, I am okay, I do my activities. When I try to get up, that my legs will have pulling sensation. Sometimes they will say that I am all good only when doing my regular activities, but only when I walk too much, I start getting pain in the knee. I don't know whether it is knee joint or whether it is muscle, or they also get confused with whether it is a nerve problem. Then they will have associated other symptoms, you're understanding. So once you talk to the patient, you get a lot of findings. Then, like I said, we have different tests. We do test on the patient. Then we have examination, like if we need a x-ray or a MRI. But for any kind of joint, the best is this dynamic ultrasound scan, which we have this machine. So once we do all those things, then what I understood, I will explain this to my patient. Okay, whether sometimes the patient are very conscious about asking too many questions, but I motivate my patients to ask more questions, because the more they ask, the more faith we are developing. They're understanding. So they will be like, ma'am, I'm sorry, I'm asking you more questions. I'm like, no, you have all the right to ask questions, right? So that is how, because what I know about the patient, when they accept that this is my condition, then they will abide by all the instructions I'm going to give them. Because any degenerative condition I'm treating, or any condition I'm treating, the support has to come from the doctor and from the patient side. Okay, alone I cannot say that I will do one injection and tomorrow you're fine, you can do everything. No, nothing like that will happen. Patient also has to contribute. You're understanding. The lifestyle modification needs to be changed, or dietary habits needs to be changed. The activity, physical activity needs to be included. So unless and until patient understand whether what is the importance of doing all those things, they will not do.
Yes, ma'am.
So this is how we counsel the patient, this is how we talk to the patient, and this is how we convince the patient that why we are going to give you very good results, why we are going to give you the best treatment and the best success, but only when you also contribute. So counseling plays a very important role. The most important thing is patient should accept the condition that I'm suffering, I need to make changes within myself, then only someone can help. So all those things I have seen plays a very important role, because patients in our clinic, patients will come multiple times, so they have so many questions, and every time they come they ask questions, and that is how we also learn. When the patient comes and talk to us, and then we think, oh yes, right, the patient has this, no, so what to do next? So this is a very talking to the patient about the patient condition is the best thing.
Yeah. Let's continue on the youngsters only for this episode. Two things are happening vigorously these days. Among guys, it is that they are exercising too much, doing a lot of treadmills and all that, and we are observing the knee pains in that category. Another category is among the girls. They are going behind the size zero and cutting all the fat intake, which is resulting to the low lubrication loss among the joints. How do you suggest? What are the preventive measures to those too much health conscious or the figure conscious youngsters?
Yes. See, when we talk about health consciousness, now general population is taking it in a wrong way. Health consciousness means, or taking care of your health means, first to understand what your body needs. Okay. Like you said, going to gym, doing excessive exercises, excessive using excessive machines without a proper training, without understanding your body requirements, then definitely we see a lot of gym injuries. We see a lot of young patients coming with different kind of injuries, which is wrong. So first thing is, you need to have a proper trainer who can tell you actually that what is your body type and how your body is going to respond. And the second thing is, these people want everything to happen immediately,
Yes.
which is like really impossible. If anything you want, it has to happen over a long period of time in a consistent way. So if you're losing weight, if I lose weight 5 kg in a month, and then after 2-3 months, you see, I'm back to my normal diet, I'm back to my normal lifestyle, and everything will be back again. So like I tell my patients also, you have to be very consistent, and when you want to be consistent, you do your regular activities as it is. You eat everything you want, but decrease the quantity how you eat. And physical activity also, we don't just randomly start. So like I said, that patients will come to us multiple times, so in every sitting we will tell this much activity you need to do. If you are comfortable, next sitting we will increase or decrease, like that. So like you were saying, gym, young boys going to gym and doing treadmill is like a big culprit when it comes to knee joint, because now fitness, and not only males, you see females, no, housewives and all those females, they are now buying treadmills at house and they are running on treadmills. So that is a real problem when it comes to knee joint. Because you can go for swimming, you can go for jogging, you can go for cycling, but definitely treadmill is a big no, because it is going to affect your knee joint. And similarly for females, those girls and boys running after zero figure, and just completely cutting off their diets and not forming a proper pattern, this is completely wrong, because it is going to negatively impact your body. Okay, because you're not taking good dietary supplements, your diet is not sufficient, your bone needs calcium, your bone needs vitamin D. We don't go out on sunlight these days. What we do, from the basement of our house, we go to the basement of the office, then back to house again. So this is wrong. We don't have sunlight exposure, no vitamin D. So all those things has a very important role to play, and that is why we are seeing that the knee pain, what used to happen at 50-55, now the shift has happened where we have 35-39 year females and males coming. And it's really shocking that when we do a scan and when we measure the cartilage value for these young people, like 35, 39, 40, they have like 50%, 60% loss. So this lifestyle modification is very, very important.
Is it true that less intake of fat leads to the lubrication problem amongst joints?
No, not like that. We cannot directly say that any kind of less fat that you're taking is going to decrease the cartilage of the joint or the lubrication of the joint. What happens is, how joint lubrication is related to dietary thing is only because of weight. If more weight, it is going to put more pressure on the joint, and definitely the cartilage loss will fasten up. Okay, but any kind of food that you are taking does not have any direct relation with the cartilage. Okay, our food will not reach to the level of that minute cartilage. Okay, so you need to keep a check at your weight. That's all.
Nowadays, people are using excessive calcium intake also, and when I was young, every house used to have that calcium Sandoz tablets, where even infants are also prescribed in my younger days. Nowadays, little bit it decreased, but yeah, among the youngsters, everybody are using the calcium supplements. Are there any side effects for this?
See, calcium definitely we need to use to keep our bones healthy, because again, bone problem, we think that it will start when we are aging. No, it is not like that. Our bone health peaks at the age of 35. Okay, and after 35 there is an imbalance of bone forming cells and bone losing cells. Okay, so we need to keep a check of our bone cells and our bone mineral density from a very young age. So there is a dietary requirement of calcium. Okay, so usually it is somewhere around 700 to 1000 grams, and if our dietary requirement is going to fulfill it, it is good enough. But sometimes we see that the dietary requirement is not good enough, then we need to take supplements. Especially in females who have gone through early menopause, like in early 40-41, they have started their menopause, so they are very prone for getting their bone mineral density lowered, so they need calcium requirement. Then those whose bone mineral density is actually very less and they are prone for fractures, and their x-ray shows osteopenia, osteoporotic features, then definitely calcium supplements requirement is there. Okay, but like you said, excessive calcium, definitely if you're taking excessive calcium, then renal stones, calcium stones and all those things, chances are there.
Okay, ma'am. Is there any difference in the diet requirement between vegetarians and non-vegetarians?
See, when we talk about vegetarians, definitely there are few deficiencies that will invariably happen in vegetarians, like B12 deficiency. No vegetarian food will have any quantity of B12. Okay, so they will have those burning, tingling sensations in the hand, in the legs. They will have cramps, which are very, very common. They will have mouth ulcers, very common. But apart from that, if you are taking a balanced diet, balanced diet is something that you have taken from your childhood. Okay, so now if you are you see, when you go to different states in India also, the staple food differs, right? When you go to north, it is more of wheat and rotis that we take. When you come towards the south, it is more of rice. So whatever we are adapted to since childhood is the best food for you. Okay, now the only thing is that you need to restrict your quantity, that's all. But otherwise, majorly vegetarian, non-vegetarian food diet is not going to hamper you in a large way, except for few things, like definitely vegetarians need to have more proteins and they need to understand what gives you more proteins. So protein content should be good, a balanced carbohydrate and fat content should be good.
Okay, one more question regarding the diet, ma'am. Nowadays the social media on more cookery channels, especially as you mentioned north and south, people say this particular knee pain problem is more in South Indians. Why? Because they don't eat the gond, or which is called as edible gum. Is it true? Only the North Indians eat, so they are very much this knee problem is very much less. Is it true?
Sir, it's not like that. See, we need to go into research and find out that what is the incidence of knee pain in north and in south. But there are few conditions that will definitely add to your knee joint conditions, is like the dietary habits, your weight, your lifestyle, how is it, your physical activity. But any kind of food, like you were talking about edible gums and all, I don't think it plays a very major role in increasing the incidence of knee osteoarthritis towards the south. It is, what is your daily activity, what kind of activities you do. So I can tell you that it is more common in females as compared to males, and in females it comes at a little early age, like usually we get from 41, 45 like that. Males usually will come after 55, 60 like that. But it all depends upon your daily activities, your genetic build also.
Okay. How to avoid this genetic build?
We can't avoid, sir. That is what we have been going through. But that is not under our control. But what is under our control is to keep our body weight at check, to keep a good lifestyle, right? Any kind of sedentary lifestyle we need to change. If we are overweight, we need to reduce. If we are continuously at home and then we don't have any kind of physical activity, that needs to be checked. Then any kind of walking, jogging, swimming or gym activities need to be started. And like I said, we need to keep a very healthy bone. Okay, and this starts at a very early age. Okay, so like when you are at 12 years or 14 years, that is the peak spurt that will happen. Okay, so if you are taking good food at that particular while the growing age, definitely your bones that are forming will be good. Okay, so it's not like when we reach 40 I should start taking care of bone. It's not like that. So very early age, if you follow all those things, then lifestyle is going to be good, and that is under our control. Rest of the thing we can't control.
And nowadays one more question regarding the diet. one more. Nowadays, this vegan lifestyle has come into the phase where they are avoiding even the milk also. Is it true in any way? And they are depending on some soy milk, groundnut milk, and all that.
See, dairy products are definitely important because dairy products are the only source or the major source of calcium. Okay, so avoiding any kind of dairy products is definitely not a very good idea. We have different types of diet patterns that have come: the keto diet, the intermittent fasting, turning vegan, avoiding specific food. I think that is not a good idea because when we want to maintain a healthy lifestyle, it has to be very consistent. You turn vegan for two years and then again you come back to your normal. That is not going to work. So what you have been raised with, what kind of food you have been raised with, what your body is adapted to, that is the best thing. A freshly cooked food is the best thing that you can do to yourself. Only thing is that you need to keep it balanced. Okay, so I personally do not endorse this idea of choosing a specific kind of food, but definitely for few people it works, for few people it doesn't work. So you need to, it is very individual that you need to see that what is working for you. But any kind of fancy things, I think that should be avoided because these are all market driven.
Okay.
See, you see 10 years back, did we had all those things, intermittent fasting or keto diet or all those things, or organic food? We never had that. Okay, so that is all market driven, that new products needs to come, the economy needs to run, and so we all go towards it. So but best thing is what you are adapted to since childhood, what your body accepts is the best thing for you.
Ma'am, your concept is neuro-orthopedics. You have told the precautionary measures about the orthopedics so far. How about the neuro?
See, our concept is pain management, where we deal with all types of chronic pain, whether it is because of any musculoskeletal conditions, which you can categorize it into the orthopedics, or it could be because of any spine problem, nerve related problem, which we can classify it into neurosystem. So when I talk about musculoskeletal system, like knee joint, shoulder joint, ankle joints, ligament injuries, all those things will fall there. And then when we talk about nerve compression, like we get patients of sciatica or cervical spondylosis, those will fall into this category. Now, back pain is very, very common. You understand? But when we go, when your pain is not coming down, you go to a treating doctor, they ask you for MRI, or you have disc, you need to undergo surgery, or you go for physiotherapy, you take this tablet. That's not the case. Every back pain has a reason, and there will be at least 50 reasons of having back pain. It could be because of muscle, it could be because of nerve, it could be because of any kind of joint. There are small joints, ligaments, so many things. So properly identification of the reason for your back pain is the most important thing. So like I was mentioning, talking to the patient, what activities is exaggerating their pain, in what activities the pain come down, what is the normal daily routine, and since how long the pain has been there, is there any associated red flags, everything we need to understand, classify it, and then we can confirm it with a diagnostic test like MRI or CT scan if required, and then we can plan a proper treatment.
Ma'am, in the recent times, what was the most interesting case have you came through where a patient usually at some point of time they will be losing hope, and after coming to you, they regained? Anything like that?
See, recently one 80-year male patient has come in wheelchair with a Euro bag. Okay. Now, why the Euro bag was put? Because he was not able to even go to the washroom, and so he came with a Euro bag, and then at that age he was not able to walk because of excruciating knee pain, and his sons, those who have come, they were like, "Ma'am, first only if you can remove the Euro bag, we are going to be the happiest. We just want him to at least walk a little so that his Euro bag is removed." And it's not that difficult actually. Okay, when you expect certain some amount of pain relief, it is not actually very difficult to give to the patient, provided you need to understand that how much is the damage and give them proper treatment. Okay, not surgery is not the answer for every treatment. Just because he is 80 years and just because his knee is grade 4 osteoarthritis, you need to go for surgery, and and the patient is not accepting surgery and he needs to suffer, this is wrong, right?
Yes.
So we offered him our treatment and we gave him a proper protocol, and in the first sitting, to decrease his pain, we have done a small radio frequency ablation. Next sitting, we motivated him that see, whenever you are coming to us, you have to walk and come, then your Eurobag is going to be removed. So next sitting, he came walking with support, definitely not properly walking, but with support. So the change that we saw in the 15 days, that patient coming to us in wheelchair and then motivated to walk on support, was really overwhelming. And then that was the time, like, then I told him that you can go meet your physician whom you have been seeing for this, so that the Eurobags and everything can be removed. And so now the patient has to come for PRP, for regenerative therapy. So we are hoping good things will happen, because 82-year male, if he is not walking, slowly they become bedridden.
Yes.
Now once they become bedridden, the muscles will become stiff, the joints get restricted, and then bed sores will start, then all the metabolic changes will start happening in the body, and then again the course is like keeps on deteriorating. So at old age, make sure that you're active.
Yes. Yeah, this is very much encouraging to the old age group.
Yes.
Ma'am, at that particular time, patients will be coming with 2 to 3 complications. How do you deal with that?
See, complications means medical complications, like patient will be hypertensive, patient will be diabetic. We have patients coming with CKD who are on dialysis, because of the creatinine is somewhere around 5, 7, like that, and they cannot take painkillers, they have excruciating pain. Then we have patients who have come with open heart surgeries, or patients who are battling cancer with all metastasis into the bone and all those things. Such patients will come. So like I said, the first thing is we need to understand. So now if a patient is coming with knee pain and we tell, okay, no, you need to do PRP, that is not going to work. We need to identify whether the patient need PRP or not. You're understanding? And so that is how we examine the patient. We then follow up with the patient, we see their reports, and then identify any medical condition which needs to be taken care of is a priority. So for example, if patient is uncontrolled diabetes, definitely it needs to be controlled, right? So then again, we give them proper follow-up, that you need to meet a physician to control your sugar level, what tablets they are taking. Sometimes patients will come with both legs swollen, pedal edema, they don't worry about that much. Then they will say, no, it comes when I keep my leg hanging, it is there, sometimes it is there, sometimes it goes, but actually when you get evaluated, then there will be associated cause. There could be cellulitis, there could be DVT, so many conditions are there. Okay, so it is not that patients are coming to me, I'll do PRP, patient should go back. No, we need to address the medical conditions at the same time.
Ma'am, is your treatment time taking when compared to other?
See, this treatment is a natural way of healing using patient's own blood. The processing of plasma will take around 40 to 45 minutes, and then injecting will it will take another 15 to 20 minutes. So altogether, the patient will be with us for like 2 hours. This 2 hours, we are injecting the plasma, we are preparing the plasma, we are injecting the plasma. Then we are giving a protocol to the patient. Like I said, rehab plays a very important role. Then our dietitian will take over to tell the dietary modification, then our occupational therapist will take over to tell the activities they need to do at work. So it is going to take 2.5 hours in the clinic, and then patients can go back home. We have lots of young patients going to office, so they come and they take the shots, they stay with us, and then they can go back to their office and then work. So it's not time taking, it's done as a daycare procedure, but it will take at least 2 hours, 2.5 hours in the clinic for each patient.
Okay, and final cure, is there any difference between your treatment and the traditional treatment?
See, in my treatment, and see, the traditional treatment is either physiotherapy or either surgery. Okay, my treatment, then again, when you go for physiotherapy, it's like physiotherapy is important, but only physio is not going to help the patient to relieve of pain. Going for a major replacement surgeries, you know how difficult it is to undergo any kind of surgery, especially major surgeries like knee replacement, where you want to cut your bones and put an implant, which is a foreign body. You don't don't know whether your body will accept that implant or not.
Mhm.
So then you have a good 6 months of post-op period where you have excruciating pain, and then you have to do a lot of physiotherapy, extensive exercises, and all those things. But our treatment, like I said, is done through injection. You don't need to stay in the hospital. Immediately you can go back and resume your activity. There is no side effects, no complications. This is suitable in any kind of medical condition, like whether it is you're hypertensive, whether you're diabetic, with CKD, with kidney problem, on dialysis, open heart surgery patients. It is safely done in all patients without any complication. So this is one of the safest treatment for patient, and most important is the acceptance of this treatment for the patient. When you imagine me telling to you that you need surgery, or me telling to you that one injection will suffice. What will you choose? The moment you listen surgery, that gives a lot of anxiety in the patient. Okay, so the first thing is acceptance of the treatment, because when we started 8-9 years back, we used to tell to the patient, see, this is a new treatment. But now the patient have accepted this treatment in a way that they come up.
Yes.
So, we get a lot of word by mouth patients where they come that this treatment my mother took, now I want for my mother-in-law. So like that, or someone has taken in their village, or someone in the office. So it is like that, the patient has accepted this treatment because it is a very safe, very patient compliant.
Yes.
So this is one of the best treatment where you don't need to undergo any kind of surgery. So there will be no bed rest. You can resume your activities, and everything will be as according to your normal daily life.
Thank you very much, Madam Doctor. And this is the present episode of Epiome. Surgery is very much critical in any case. So if there is any alternative for the surgery, definitely we have to have the second opinion on that. So for that, I request all our viewers to consult Epiome Clinic for any sort of knee or any other shoulder or neuro related pains. And that's the end of the episode. Let's meet in the next episode. Thank you very much. Thank you.